welcome everybody. Thank you for coming. My name is Billy. I'm the nurse practitioner here that's doing Biote, and Dr. Colgraf is as well. Today, Dr. Secrist is going to give you a talk about Biote and hormone therapy. He is from Wichita, Kansas, so we appreciate him coming up here today. He has been doing Biote for 7 years now?
It doesn't feel like 7. It's been 5.5.
Okay.
Yeah, still.
Okay. So we appreciate him coming, and this is very informal. He's going to give the talk, but if you guys have any questions during it or after, let him know, or if you feel more comfortable going into a room afterwards to talk privately, we can do that too. So we are going to be doing blood draws today, so if you did want to do that today, we can do that. If you don't feel comfortable doing that today, our deal for today will last for a week, and you can bring a friend and they'll get the deal as well.
We'll tell them that at the end of the video.
Okay, perfect.
A little appetizer for the end.
Yeah, there you go. Stay tuned.
Yep.
All right.
Ready?
All right. Thank you.
Thank you very much, Billy. Hey, so I'm from Wichita. How many of you know where Wichita is? Yes, and Dr. Ron brought his plane down, so he knows exactly where it is. But here's what I tell people where Wichita is. So if you have a map of the United States, and so like Northeast New York and New Hampshire's all up here, and California's down here, and you draw a diagonal, and then you go to like Washington, Oregon, and you draw a diagonal to Florida. Where that intersects is Wichita. So now you know where we call it Land of Oz, and it's really windy there. But there was some wind on the interstate coming over here. Yeah, so that was kind of fun. So my boards are in family medicine. I've been practicing for 30 years. Can any of you in the room say you've been doing something for 30 years? A couple of you, yes, but not very many. And so I was originally, I served in the military. Do I have any fellow veterans in the audience? Yes, sir. Appreciate your service. Yep, always have a shout out to my veterans. And we're all the ones that had the DD Form 214. You only know what that is if you have one. And so I was serving for the Air Force. I did a couple of tours of duty as a flight surgeon. Real thankful to do that. And I didn't come from a very well-to-do family. None of the people from my ancestry had really ever been to college. And so for them to go to college and to med school was kind of like breaking the mold. But I just wanted more out of life that I had, but I didn't have any money. So I had to borrow money for college and borrow money for med school. And so I had these things, some of you might be able to know what they are. They're called school loans. And so I had to pay those back. And so while I'm working on the base, flying with the pilots, super healthy group of people, I'm in the ER on the weekends paying back my school bills, right? So I'm seeing two different types of patients, right? The super healthy, those responsible for our nation's defense, right? You can't be a pilot if you're not healthy. And then on the weekend, everything that lands in the ER, which is what? Heart attacks, strokes, delivering babies, trauma, just about everything you could think. The stuff that goes to the ER is a big different group. And so I'm realizing there's a big difference here between these two. And I began to develop this perspective that we don't have a lot of good treatments for chronic illnesses in America. So chronic illnesses are like what? Blood pressure, cholesterol, diabetes, osteoporosis, certain cancers, autoimmune diseases, things that people have to kind of live with. And our system teaches us how to maybe treat those or manage those diseases, but it doesn't really teach us how to maybe peel back the layers of the onion and look for the root cause of the problem. And so that's when I realized that we were offering what I call maybe fixes and cures, right? You come to us and you got your medical issue, we offer you this fix or this cure, usually in the form of a pill or surgery or something like that. But rarely does it teach us how to, look for the underlying root cause, giving us a chance to focus on what I call healing. And that's where I think the greatest medicine of all is really to teach people how to not need it. That's kind of cool. So people come to us, and if we can identify their root cause, we can reduce or eliminate the need for their fixes and cures. And so that gives us a nice extra little strategy to do. So I'm going to show you some slides here today, and we're going to talk about basically hormones. And so this is the military part of me, background of me. In the military, they teach you when you're going to do a briefing, and you teach people, you first tell them what you're going to tell them, and then you tell them, and then you tell them what you told them. Okay, so we're going to follow that format. Here's what I'm going to tell you today. We're going to talk about hormones. See, those are the messengers. Those are the things that allow us to look for that root cause. We're going to talk about the difference between synthetic and bioidentical, also known as human identical. What are the different delivery systems and options that they go to get into our body? How they can help both men and women. What are the risks, right? I heard like, oh my gosh, if I take hormones, something like bad could happen. So we're going to talk about what those are, even if they're real or not, and then whether or not those are you listening either here on this video or here in the audience today, or whether or not you're a candidate. So to do that, let's kind of start out here. This is the system that we operate here in America. It's the healthcare versus disease management system. So, and anybody that's been here in healthcare, how many healthcare providers do we have here other than myself? Yes, yes ma'am, you. Billy, you are as well. I know Dr. K is. Well, we tend to want to go into the healthcare system to learn how to give people health, and that's kind of our altruistic goal that we set, and we enter the system, and somewhere along the way they kind of shift the goalpost on us, and they get us focused on disease management. How can I manage your blood sugars? How can I manage your cholesterol? And then we're taught all these things to do that, but we're not really taught what I call health care, how to promote care. And so in a way, the system I was raised in is more of it's not a health care system, it's a sick care system. So I don't mean to throw rocks at it, but that's just what it is. And so I was working in the emergency department, and I'll tell you that shortly, but this is that system. Conventional medicine says, hey, you're born, you move along here, you get about 20s and 30s, you're kind of peaking out, and then somewhere after that, it kind of starts downhill. And so we see ourselves entering the 60s, 70s, 80s, and then our system teaches us how to help you live longer. And that's fine because, you know, once somebody hits the hospital or the ICU and all that, we can help you live longer. We have great cures and fixes in that regard, but what we don't have is something that restores our quality of life. Okay, so somewhere along the line, the quality of life is going down, and that's conventional medicine. That's the system I was raised in. So there was me working in the ER on the weekends. I'm that guy in the ambulance at the bottom of the cliff as the patients start falling off. I'm scrambling frantically trying to catch them as they land into my ER, and I either treat them and street them, or I treat them and admit them to the hospital. My in-basket was never full, empty rather, it was always full. And so this is kind of what I ran into. You know, I figured, you know what, let's start teaching people how to put up a guardrail. How do we first not fall off the cliff and then eventually need some of that system? So hormone optimization is the key. And I love William Osler, known as the father of modern medicine. He says the person who takes medicine must recover twice. Once from the disease, and the second from the medication itself. So we need medicines, but we don't want to just stay there. And I love this challenge, which was given to us over 4,000 years ago by the first Chinese medical texts. Superior doctors prevent the disease. Mediocre doctors treat the disease before it's evident. Inferior doctors treat full-blown disease. Now, I say that kind of tongue-in-cheek because I was that ER doctor treating full-blown disease, but I promise you that's the first chance I've ever had a chance to see some of those people. So now I spend my time on the prevention side of the equation, and so here's what that looks like. Our goal of preventive and regenerative medicine, there's that curve. We get up there 20s and 30s, and then right as it starts to dip off, when we start heading downhill, we stop that downhill thing and we go lateral. We're looking for vitality extension. We're looking for quality of life extension, retaining that youthful vigor. In fact, so it's the difference between lifespan and health span. Now, both of those people are the same age, but I don't know about you, but I'd rather be on the right side of the equation. So that's inspiring to me. And so it's a functional medicine approach. And this is a complex bunch of circles, but if you basically look here, let's say the patient comes in and they're having symptoms of anxiety and low mood, and they got situational things, and conventional medicine says, hey, we need to give you an antidepressant. You're depressed? And so my question at that is, does that person really have a Prozac deficiency? Do they have a Wellbutrin or a Xanax deficiency, and that's what we're fixing? Granted, we need those medicines temporarily, but what if their real issue is thyroid or hormone or vitamin D as an underlying root cause of the problem? So if we can restore that, set it back to where it was, then now we reduce or eliminate the need for the medication in the first place. Again, that's a functional medicine approach. So here's what you need to know. Number one, not all hormone therapies are created equal, right? It's not a cookie cutter approach. It is not a one-size-fits-all approach. It's a focus on customization. Customization. What is it, what do you need for your kidney level, your activity level, your hormone levels, crafted to your unique body and situation? Not a general approach. You need a certified expert, and you need to embrace this concept called optimization, not just normalization. So what do I mean by that? So let's say somebody has, here's a way to think about it. So when you get blood drawn, the computer services what? This sector of Iowa and however many 100 miles there is all around here, and the computers all compile the data, and they compile it under what's called a bell-shaped curve. Okay, so it's a 95% confidence interval. 95% of the population will fall within this range for that particular blood test. Okay, and what happens is the younger people are more on this side of the equation. The older people are more on this side of the equation. So that's that curve, right? And then what happens is we all enter a season of our life sooner or later where we're saying, you know what, I don't feel myself anymore. How come I'm tired all the time? I've got dry skin, brittle nails, foggy memory, constipation, low energy, elevated cholesterol, brain fog, cold hands and feet, poor libido. My joints hurt. I can't sleep very well. I'm not getting results in the gym. I'll keep going if you want, but usually people are like, yeah, I get it. Yeah, you hit a few boxes there. Okay, fine. So people Google it because they're looking for answers, right? That's what people do today. They just Google everything. So Google says, maybe go get your thyroid check. So you go get your thyroid check, and there's that curve, and let's say your test comes back about right here, kind of that lower part. And here's usually what happens. The phone call back to you sounds something like this. Hey, Mary, we got your blood test back. Looks to us like you're in the normal range. That's the words they like to use, normal range. And you're like, well, I don't feel normal. Something's up. What is it? And they're like, well, I don't know. Maybe you're just getting older. I mean, they really don't have a good answer for you because you're in that range, okay? So what we do is we take it from this side of the curve and move it over to this side of the curve. We call that optimization. In essence, putting you in the upper quartile of the reference range, restoring you back to where you were 10, 15, 20 years ago, back at the season of your life and you felt your best. Okay, that's all we're doing. As a result of that, a lot of amazing and good things happen. So if you still feel sick but your labs are normal, it's like they're just not optimal. They're in the reference range, but I promise you, if you look at the lab slip, it does not say on the lab slip normal range. It uses the words reference interval or reference range. And so that's the difference and the subtlety that makes everything happen. So here's the thing about hormones, okay? Hormones are a lock and key. That's how they work, just like insulin. You've all heard of insulin. Insulin is a hormone, okay? So here's the question I pose. Do we lose our hormones because we age? Or is it that we age because we lose our hormones? See, I think the latter is true. The aging process accelerates. So if you feel like this and are told you have normal labs, imagine how you'll feel if you have optimal labs, okay? Or like this, for example, feel like this. Or you could feel like this. Or maybe you'll feel like this. Let's see if I can start this video right here. Oh, right there.
Mr. Richard Fader from Fort Lee, New Jersey, writes in and says, Dear Rosanna Dana, last Thursday I quit smoking. Now I'm depressed, I gained weight, my face broke out, I'm nauseous, I'm constipated, my feet swelled, my gums are bleeding, my sinuses are clogged, I got heartburn, I'm cranky, and I have gas. What should I do? Mr. Fader, you sound like a real attractive guy.
Yeah, I kind of date myself with that one, right? So, yeah, I thought she has a hormone imbalance. That's the real issue. I mean, that's all it is. So if you want to know if that's you or not, well, just take a look at the list here, okay? Extreme fatigue, mood swings, anxiety, depression. As you go through the list, just mentally go, check, check. Now, nobody sharpen their elbows and elbow the person next to them at all today. We're not about that. But if you know someone that has these symptoms, you're not alone. These are all rooted in hormone balance. There's no reason to hit the panic button. So how about fatigue, right? Anybody up here in Iowa ever get fatigued? No? Two of you? Okay, right. So where I come from, Wichita, people get fatigued. They do stuff to get energy. What do you guys do around here if you're tired? Coffee, right? How about energy drinks? Energy drinks make it up here to Okoboji? Nope. People drink those? What do they sell for? Does anybody know? I have no idea. $4 maybe? Okay. For a little one? Okay, gotcha, right? So here's the question. I got a patient I asked that too. He was a young guy. He comes in, and so I'm talking to him and stuff. I said, hey, do you ever drink energy drinks? And he goes, oh yeah, doc, I take a Monster every day at 3:45. I'm like, okay, why is that? He goes, because that way I have enough juice or energy to let me finish my shift. I can drive home through the traffic, and then by the time I'm home, it's only then after that the crash hits. Right? So he knows when that wears off. So here's what I've learned. If you borrow energy from the future, you have to pay it back. And so he's got it timed out, so his payback is he's at home in his couch. All right, so here's the question. If you're tired, do you really have an energy drink deficiency? Right? Do you have a coffee deficiency? And I like coffee and I drink coffee, but that's not my real root issue. It could be that my hormones aren't adjusted. Right? So we have a symptom checklist today, and they'll probably hand that out to you. If you haven't seen it, it's over there. Fill that out, because that is what determines your before picture. See, we need those symptoms. Here is not a system where we treat some blood test number. We treat the patient. So to do that, we need a symptom checklist. So we use 80% of the decision making for the dose goes into treating the patient. 20% goes into the blood values. We need those labs to guide us. But this is not a system of treating a blood test. It's treating the entire patient. And that's what I love about that. So we need that symptom checklist to do that. So there you go. There's your summary. As time travels on and the hormones start dropping, all the symptoms happen. But look what happens if you restore the hormones. These things disappear. We get better. We feel younger. We actually are younger internally, especially from a cancer risk reduction. So here's our methodology. Okay, the Biote method, what does it do? It balances out testosterone, estrogen, thyroid, and vitamin D, which is actually a pro-hormone. The method also incorporates medical-grade nutraceuticals that make the pellets last longer, and it makes them work better. So how about going through some of these? Andropause. Andropause, that's like menopause for men, or manopause. Okay, so 20% of the males over 50 have low testosterone. Quite frankly, I think it's way higher than that. Clinically, in my practice, I see these kind of symptoms in men in their 30s. And it's very directly linked to diabetes, blood pressure, cholesterol, sleep apnea. All of those are directly linked, and of course to the heart disease underlying issue. So testosterone is really important. Here's the major facts about the hormone testosterone. It gives major symptom relief and protects the bones, the brain, the heart, not just the relationships. Present in both men and women. I was impressed to learn that the ovary actually makes more testosterone over the life of the ovary than it does estrogen, by 3 to 4 times. So it's present in both men and women. Large amounts in men, smaller amount in women. Men age 30 to 70 lose 1 to 3%. It's actually higher than that. I think that starts in their 20s. And women can start losing it up to 15 years before menopause. Typically the females will report, you know, it all started after the birth of my second child, was in my early 30s, and I just didn't have the energy to keep up, and they report those symptoms because their testosterone is starting to drop off, okay? So I show this because it reminds me, just like the iceberg, 1/9 of the iceberg is above the surface. 8/9 is below the surface. So when the guy comes into me and says, hey doc, by the way, things aren't working as well in the bedroom as they used to, you have any of those little blue pills? I now know, hey, wait a minute, what's going on below the surface? What's his blood pressure? What's his cholesterol? What's all that going on? That's the major issue, even though he comes in for the top one. So here's a chart, probably the most important slide in the whole presentation. You're welcome to snap a picture of this if you want. But this is serum testosterone levels in young men, okay? So imagine the young men that you know in your life, perhaps in their 20s, that testosterone level should be maybe 800, 900, 1,000. Well, it's not nearly that high these days for various different reasons. And then what happens, it starts dropping a few percentage points per year. And when that does, us men, we start gaining weight around our midsection. Sarcopenia, our muscles begin to soften. We don't like that at all. And as it drops below 900, we've now lost the protection against future Alzheimer's. In the 800s, we start getting actually higher risk for prostate cancer. In the 700s, metabolic. Down here in the 400s, fatigue, loss of libido. 300s, elevated cholesterol with heart disease. And then down here in the upper 200s, depression, anxiety, PTSD symptoms start surfacing. And then finally, when it gets clear down here to the low 230s, then and only then does the plumbing get affected. That is the last thing to show up while all the others may be in jeopardy. So us men, we not only like, we need our testosterone. We need it for our brains and our bones and our hearts, not just our relationships. So this therapy is going to ramp us men right up here to 1,000-ish. Boom, and you're off and running 4 to 5 months. Can I get some water, please? So I occasionally hear from time to time, hey, doctor, I don't know if I can take that testosterone. I heard that if you take testosterone, it's like throwing gas on a fire, and that could give me prostate cancer. Maybe some of you have heard that. I know I heard that in medical school. Well, nothing could be farther from the truth. Actually, the polar opposite is true. So let me introduce you to Dr. Morgan Taylor. He's the chair of urology at Harvard University in his working years, and he is the most authoritative figure in the world, thank you, in testosterone. And he has shown that there are 19 studies that show there is no increased risk for prostate cancer whatsoever on men who are on testosterone therapy. In fact, he says the opposite is true. Low T is associated with a higher grade prostate cancer at presentation. So it's not only that high T does not cause it, it's that low T sets you up for worse prostate cancer, and it's more advanced by the time it does develop. So it's very protective for prostate cancer. So these are the positive effects that testosterone has in both men and women. Restoration of energy, vitality and zest, relief from anxiety and depression, improved mental clarity, relief from brain fog, mental focus, better libido, better performance. Now we're talking about protecting the breast and the prostate from cancer, protecting brain and heart and bones from future chronic illnesses, strengthening the bones and muscles, reducing body fat, especially in females, and of course reducing cholesterol. So people love their testosterone. This is true for bioidenticals. Out of endocrinology, all the bad cholesterol numbers go down over months while the good cholesterol numbers rise, so it's protective for heart disease. Now I'm just going to show you this because this is some of my own personal private medical data. I figured, you know what, I'm reaching a season in my life where I need to really see the number one cause of death in America is heart disease. So I said, I'm going to go get my heart scanned, okay? So this is a scanner. You hold your breath for 10 seconds. It measures all the calcium buildup in your arteries and gives you a predictor of what your chance of a heart attack is. So you're sitting there in the front row. This measures my calcium score. It says total calcium score. Can you read that number? What's it say? 0. 0. Wow. And I look down here and it says coronary age. Less than 30. Is that what that says? Less than 35. And I'm like, oh, I don't know if that means 29 or 25 or what that means, but I'm thankful, right? And in Texas, they say it ain't bragging if you've done it. So my wife and I both got scans, and we're thankful that that's where we're at in our season of life. I just love that. I sent that to a cardiologist friend of mine. He says, because he sends people off for these scans, you know, they're very affordable nowadays. And I sent him my results, and he hits me back on the text. He goes, oh my gosh. He goes, you need to start smoking cigars and eating ice cream every night. He was kidding, of course, but that's what he said to me. He's like, oh my gosh, so I'm thankful for that. So how about menopause? Ladies, 3,500 women every single day in America are entering menopause. Symptoms begin 15 years earlier. Why? Because that's when the testosterone starts dropping. They're affected more ways than you know, and they do not really ever get over it. You get through it, or symptomatic, because it's a lifelong problem. So as their testosterone drops in the premenopause years, their rate of heart disease is 1 in 7. And then when they lose their estrogen at menopause, it more than doubles to 1 in 3, equal to that of their male counterparts. So that's a real big deal to protect the heart. So estrogen, what does it do? It's present in both men and women, just like testosterone. Yes, us men have a little bit of estrogen. We need estrogen. It's what makes us nice, right? If we don't have enough of it, we're irritable and we're angry and we're out in the streets picking fights with the nuns and we're edgy and stuff. So we need a little bit of estrogen. Not a lot, but we just need a little bit. Large amounts in women, small amounts in men, has over 400 functions in the body. And so what does it do for the females? Hey, it controls their hot flashes, maintains that youthful skin appearance, increases their happy hormones, strengthens their bones, makes it stronger, maintains the memory, preventing them from developing Alzheimer's and neurodegenerative diseases, lowering the risk of heart disease, and again, protecting the bone, the breast, and heart. Okay, so hormone therapy, there's your choices. Here's how we replace that. You have your synthetics and you have your bioidenticals. The synthetics can be given in the form of pills, patches, and creams, shots rather. Sorry, bioidenticals, pills, patches, creams, and then pellets. Those are the two different options. When I say bioidentical, I mean human identical. What I mean by that is it's the same exact molecule that is produced in the ovary and in the testicle. Okay? The identical molecule. Not a synthetic one produced from animal parts or urine that hits alternate receptors and creates side effects, but rather the exact molecule produced by our bodies. So this study hit about 20 years ago, conventional hormone replacement. There's a product called Prempro. Some of you have heard of a product called Premarin. Is that true? Right? Premarin is made from horses. In fact, it's made from pregnant mare's urine, hence the name Premarin. Isn't that interesting? So they found that when you take Provera with it, the progestin, that they reported all of these things. It was a flawed study. They said, oh my gosh, hormones cause cancer, heart attack, stroke, blood clots, and Alzheimer's. So widespread across America, everybody quit their hormones. The doctors freaked out, the patients freaked out, and we lost, unfortunately, a generation or more of women because they unnecessarily came off synthetic hormones. It wasn't the estrogen that was causing it. They later published this study and showed that it was fine. It was the oral progestin. It was the Provera. It was the progestin that was part of that pill that caused all these problems. Not hormones in general, just that progestin. And so that took forever to come through. And so now there's different delivery systems. So there's a patch. You can put on a patch. You just put it like right there on your arm or whatever. And it lasts 3 days and then it wears off. The problem is 45% of the people don't absorb through the skin. That's why androgel and testosterone gels, bless you, doesn't really absorb well, so people get peaks and valleys. Okay? It also can rub off on other people. Just like creams and gels. If you put enough on, you have to do it twice a day, right? Because it wears off. And then it can transfer to other people, babies, pets. I'll still never forget the guy that came to see me. He's a friend of mine, owns a business in Wichita, and he called me up one day because his urologist had given him some androgel because he was having low T. And then he calls me up freaking out saying, hey, my 1-year-old son is developing pubic hair. And it freaked him out because the androgel was rubbing off onto his 1-year-old. Thank goodness it's not dangerous, but that's a little alarming. And he didn't know better. He was just taking care of his son. So we quickly stopped all that and got him back on track. But that's what can happen with those creams. So a lot of men will go after shots, right? Shots, significant roller coaster effect. You take the shot, it spikes up to 2,500, maybe 3,000, then it drops off really rapidly. And so you feel great while it's good, and then you feel bad when it drops, so you have to reshoot, and then you get to feel good, followed by a drop-off. And so us men, we ride a hormonal roller coaster, and everybody around us probably knows when it's time for our shot before we do, right? So those aren't really the best. Plus, it has to be metabolized in the liver, so up go the liver enzymes, up go the cholesterol numbers instead of down. So bioidenticals really have set themselves apart as the preferred delivery system. What are they? They're natural plant-derived compounds. We extract the steroid ring from the soy plant. There's no soy in it whatsoever, so allergies are not a problem. We take that ring and we replicate it to make the exact molecule produced by the ovary, the exact molecule produced by the testicle. And we put that in our body, and it lasts 4 to 6 months in some cases, right? 3 to 4 in female, 4 to 5 in male. Provides a steady stream of hormone, individualized dosed, customized to the person, implanted under the skin. We make a little numbing medicine right here. We place a little nick, insert the pellet, and put a Band-Aid over it. It doesn't even have a stitch. and you're off and running. In fact, you're better than off and running because blood flow starts going by that pellet. And what happens is the more blood flow that goes by, the more hormone release. We call that release based on cardiac output. So the more you work out, the higher levels you get, as opposed to time release where it wears off and you have to do it again. So it's remarkable. So pellets, people say, hey, is this some new fandangled therapy that got started 2 or 3 years ago? The answer is no. Not even more than 2 or 3 decades. We're talking like 7 or 8 decades ago, clear back in 1939. Widely studied, the most widely studied across the years and the miles in 5 other countries as well. So here's your estrogen levels when you take the different delivery systems. So there's the pill, you got to take it every day, it peaks and then it falls off. Then you retake your pill and then it falls off. Patches last 3 days, and then you have to put a new patch on. But look at the implant, steady state, just like how our bodies work. This is a concept we call endocrine mimicry. We are mimicking our body's own endocrine system as it relates to thyroid, testosterone, estrogen, and vitamin D. So here's the methodology. It's the right kind of hormone, meaning it's not synthetic. It's the right amount, meaning it's customized to you, your system, your frame, everything else, your activity level, and it's the right delivery system. Again, basically just mimicking the actual hormone itself, okay? So that's kind of cool. So what's the method of therapy? It's safe, evidence-based, hundreds of studies on it, 75, 80 years, clinically effective, no roller coaster effect. You put it in a few times a year, very low side effect profile. It's the best method to strengthen the bones. No evidence whatsoever of increased risk for breast cancer. In fact, I will tell you it is actually protective for breast cancer. I'll show you that data shortly. No blood clots, heart attack, or strokes. And this optimization is going to be protective for the main organs of our body. So how about breast health? Breast cancer study. From time to time you hear people say, you know, hey, I don't know if I can take hormones. My mom had breast cancer. I don't know if I'm supposed to do that or not. We actually have found that it's the drop in testosterone that sets up the breast for breast cancer. Testosterone is actually protective for breast cancer. So here's some great data showing that testosterone estradiol implants does not increase the risk of breast cancer, even in breast cancer survivors. In fact, the largest study ever done, was released last year at this time, 10,000 patient years, and they found, which is over 2,500 patients, over this block of time that had a reduction in the incidence and occurrence of breast cancer by almost 40%. Are you listening? 40, not 4, 40. So not only can you take it, it is protective for breast cancer. That's a big deal. More breast cancer data. This is what we had before that study was released. 2,700 women ages 35 to 70. Breast cancer recurrence was 17 per 1,000 in the users and 30,000 in the non-users. Breast cancer death rates, 5 per 1,000 in the users, 15 per 1,000 in the non-users. And again, down here, total death rates, 16 in the users, 30%. So you can see there is a protective nature about that. How about bone health? Osteoporosis. Is that a big deal? Does anybody here know someone that ever had weak bones and then fallen and then broken a hip? Did you know their chances from dying from that fracture are almost 30% because they get hospitalized and they oftentimes develop pneumonia? More women die every year from fractures from hips than they do of breast cancer. That's how common it is. So we want to grow bone. We want the good, healthy kind of bone. So pellets have been shown to strengthen bone by nearly 3 times that of our oral conventional therapy that we have to offer in medicine today. How about arthritis? 4th leading cause of disability a couple of years ago. Testosterone and estrogen actually help grow the progenitor cells of cartilage tissue. How about brain health? Women get Alzheimer's 8 to 1 over men. Women on estrogen are 50% more likely to develop Alzheimer's. Men with low testosterone are 3 times more likely to develop it. How about the heart? Heart is protective. Love this. Marked fat reduction seen in the estrogen plus testosterone group after 2 years. Takes a couple of years. We actually protect the heart, lowering the cholesterol numbers and everything. So what else is important? How about thyroid? Thyroid's like our thermostat. That's our metabolism, hair, skin, and nails. So we protect those things. We optimize thyroid. We optimize vitamin D. Again, a pro-hormone. And then women get the double bonus. Only women get progesterone. That helps them relax at night, calm in the evening. They sleep better. And so they love the effect of testosterone in their overall health. So for the millions of patients seeking something other than the Band-Aid approach, and those that want the true wellness, we invite you to look at this evidence-based medicine. It's a focus on healing, not just the fixing and curing. Okay, so here's what's next. If you know someone that's experiencing some of the symptoms I mentioned, you've got a paper here you filled out, what I would say is just check your blood test. Just get your levels done. It's a simple thing. Anybody can do it. And you find out what those numbers truly are. It might end up being quite revealing. I have yet to meet the male, who can adequately guess how low their testosterone truly is. They all overguess it. I promise you, every single time. And so what should you know before considering therapy? Well, these are the comparisons. Remember all those ways I showed you the hormones can get into your body? Well, you can do creams twice a day. You can do shots. Shots done properly for men are, by the way, twice per week, not twice per month. So run the numbers. That's 104 shots a year. I'd have a really hard time getting excited about shooting myself 104 times a year. So I don't like that. 3 to 4 per year for females rather, twice a year for males. So the pellet therapy certainly stands out. Now, what are some potential temporary concerns that some people maybe experience when they get pellets? Testosterone makes the kidney work better. Kidney's job is to absorb sodium, and when that happens, people can get a little bit of puffiness. Pellets work. That's why they potentially have some temporary side effects. And this happened to me. When I first got it, I got puffy a little bit, kind of started to realize that I was feeling like my wife was felt during her monthly cycle. I felt a little puffy, a little fluid retention. So what did I do? Took some diuretic, Lasix, peed it all off, gone within a couple of weeks, never been back. I've had 15 pellet insertions since. I'm really 85 years old. You just didn't even know that, did you? Of course, I'm joking. Yeah. So if the breast tissue has not seen estrogen, sometimes the girls wake up a little bit. They get a little tenderness. We just simply give you some evening primrose oil capsules. No big deal. Uterine spotting and bleeding can happen because the pellets uncover things. They don't cause things. Oftentimes we'll detect a fibroid or a polyp or something that's in there, and we give you the progesterone to take care of that. If you don't honor your gluteus restriction and you go out and try to run a bunch of miles right afterwards, you could pop a pellet, but we don't want you to do that, so we ask you to do that. Some females can get a temporary facial breakout with testosterone. We simply give you an antibiotic, it's gone. And men can experience a temporary reduction in the size of the testicle because the sperm count drops a little bit temporary, as would any form of testosterone. And we simply give you a compound called DIM to mitigate that or reduce it, and it's only a 10 to 15% reduction. Again, all these are temporary, and once the therapy stops, you just go right back to where you were. Okay, no big deal. So here's your key facts. Hormone imbalance can occur at any age. It is not all therapies are created equal. It is not a one-size-fits-all approach. You need to find somebody that knows what they're talking about, and low normal labs may not be optimal labs, and so that's where we would prompt you to get your blood test. So that being said, let me ask you, I've got, these are just pictures from my practice of people sending me stuff. My patients send me stuff all the time. I don't ask them to send it to me, they just send it to me. And so the rule is, if you send it to me, it could show up somewhere in a presentation. So increased energy levels, this is what people are saying about it. Improved zest for life, restored interest, improved moods, consistency in those, relief from anxiety and depression, improved mental focus and clarity, decreased body fat, greater capacity for getting in shape. Again, more texts that came in from some of my patients. It's just pretty interesting to see all this. But let me ask you, who here has had a chance to use the therapy and wouldn't mind sharing, if they're not uncomfortable, what it's done for them? Would you feel comfortable sharing that? Sure. Come on, stand up here for me. We don't, if you don't mind. Because that way, we got the camera here, dear, so we'll lift you out. It's okay. Don't worry about your pen. We didn't know she was going to do this, by the way. This is not planned. So tell me, what was life like for you before pellets?
Do you get that list up there?
Yeah, I got it up there.
All of them.
Really?
Yeah.
Okay.
Fatigue, fog, mental, joints hurt, depression, big time, crabbiness. I had that one down pat. Irritability, and I wanted to sleep all the time.
Okay.
But I never got rested.
And so you've had the pellet therapy then already?
For about 15 years.
15 years, okay. And so what has it done for you?
Put me back on track again so I could be myself again.
Anything specific? Any other people notice? Or?
Oh, yeah. I didn't bite people's heads off as much.
Okay. All right.
Increased energy, less mental fog, no aches and pains in the joints. Really, the list that you had
Okay.
was what was fixed.
I see. So anything you like best about it?
Yeah, I'm not crabby, and I have energy, and
Okay.
my brain works.
Love that. Well, thanks for sharing that. Give her a hand. I mean, we didn't plan this, but she raised her hand. I'm like, okay. Who else was going to come share? Do you mind come sharing up here? Yeah. Have you stand about right here? I'll just hold this for you. Tell the group a little bit about you, who you
Okay,
are,
so
and what
I'm
your life is like.
Yeah, so I'm Steph. I'm one of the nurses here. So do you want me to start at the beginning? It's long, isn't it,
Whatever
Billy?
you want to tell them.
Okay, so starting when we first started our hormone journey, I've always struggled with anxiety and depression. It got worse with kids. I had postpartum depression really bad after my second daughter. So I had gone to the doctor and just was kind of discussing meds again with him and wondering what I could do to feel better, what meds I tried that weren't working. I just felt like at our conference that we had, there was a slide that was like, oh, well, that's not working. Okay, here's something else. Okay, that's not working. And I'm just like, why aren't they working? And I don't like taking medicine. I don't want to be that person. And so we were starting our journey. We were going down to Dallas, Texas. And I'm like, you know what? I'm not going to start anything. I'm going to wait and kind of see what hormones can do for me, learn a little bit more too, because that was when we were first starting out. I actually did a blood test that gave me like a green light and a red light for medicines that would work for me, which had a huge list of like specific antidepressants, anxiety meds. And so they're like, well, this one's on your green light. I filled it, but I kind of popped it up in my cupboard, and I thought, I'll just kind of wait and see. It's there. Made me feel better. If I needed it, it was there. So we went down and learned about it, and I told Billy, I'm like, I'm doing this. Can I be the first patient we pellet? And we kind of all were a little bit. And going back, I have TMJ. I've had that forever. I was actually going to Mayo Clinic in Rochester because mine was that bad. We debated on doing surgery, and that's huge. That's my face. So I wasn't super excited about that. So I was pelleted. We'll fast forward a little bit. Pelleted, never started my medication. I haven't had to take anything. Maybe the Serene, I take that every once in a while. But my jaw, I can yawn. I can eat again. I'm not in pain daily. I have arthritis, which is not, I'm young, I'm only 33. I shouldn't have all that stuff going on already. So I'm sure it's correlated to my testosterone, my hormones, how you said, well, after my second baby, everything kind of, that was me. I just felt like I was on this spiral, and I'm like, I'm young, I shouldn't be feeling this way already. But yeah, it's been amazing. I'm sleeping better. Like I said, I haven't had to take my antidepressant, and not saying that, take your meds if you need them, but hopefully we do have like a wean off protocol. So we monitor you through that if you want to try and get off something, if you are feeling good. I'll take my Serene every once in a while. Usually I have PMDD, so that week before my period, I feel off a little bit. That's gotten better. But if I feel off or anything, like I'll do my Serene, and that really helps too. And we can talk to you guys about all of our Nutraceuticals too. But yeah, I feel like I've gotten my life back again. I kind of feel, I was telling Dr. Secrist, I feel kind of like I did pre-kids. Not blaming my kids for everything, but I think your hormone,
it's a roller coaster. You know, you're trying to adjust after having kids, and then, you know, if I was starting to go into premenopause, you know, in my early 30s, they kind of say it's all downhill after 30, and I'm like, it shouldn't be. That's so young. So yeah, I feel good.
Right.
Yeah.
Give her a round of applause, right? How about Dr. K? From a male perspective.
Land here since this is my clinic, but
Yeah, come on up, Doc, so we can hear you.
everybody else's, of course. And thanks, Neil, for coming.
Yeah, you're welcome.
That's quite an honor. And
Over
you
here,
can-
sir. I'll have you stand here,
Right
sir.
there, you
Yeah,
bet.
because, that way they can see you. We're recording this. So if you don't mind sharing from a male
Yeah,
perspective, as a patient, maybe.
Maybe as a doctor and a patient, I took this training down in Dallas for Biote, incredibly skeptical. And I don't like anybody, I don't like anything. So I went down there, and I have different questions and a different approach to doing this stuff than a lot of people do, and was curious about the men. So I asked every male patient that we pelleted quite a number of them down there, and I said, how long have you been doing this? Oh, 10, 11 years. How many appointments have you missed? And they looked at me like, miss my appointment? What are you talking about? I never miss this appointment. So I don't know what they were saying behind the scenes, but I got an idea now because I've been pelleted. And my story is a little different in that, a little scary because I had prostate cancer about 2.5 years ago, and my PSA is 0, which is good, but quite exciting to think, oh my God, I'm going to give this stuff. And I went to medical school 10 years before Dr. Secrist. We heard the same story. So getting pelleted was a bigger step for me. I had to have several PSAs that were 0, and they were. So I'm pelleted. So what has changed? The simplest things, we'll get to the naughty stuff later, but the simplest things. When I would turn the corner, okay, I got a new Jeep, and it has little lights on my mirrors so that it'll tell me if there's a car there, right? Or if I'm going to change lanes. Well, why don't I just look? Because my neck hurt, okay? And I didn't want to look. The little lights would tell me. And I would just slide into the lane. If the light came on, I'd go back. Now, I think I've driven next to you. Yeah, probably, yeah. And I can turn and actually look and see the cars. Now, that's a safety thing, which I had noticed about 3 weeks after taking the pellets. The other thing, this clinic is just, I can't tell you how excited we are. Yes, I'm 66. Yes, I'm going to retire one day, but I just love what we do. And I don't know of anybody better at starting projects than I am. But I wasn't real good at finishing anything until I got pelleted. I now finish projects. So I have them laying all over the place, and I've organized them, put them in tubs, and going to get to them later still, but I've finished a whole pile of the top 5 projects that I was working on. I blame the pellets for that, because I'm still real good at starting them, but I'm a lot better at finishing them. And then, of course, the bedroom antics for a man when you get to be 66, almost 67, you know, all kinds of things to say. I'm just going to say that pole vaulting out of bed in the morning is a nice change. And everything else good, too.
All right. Thank you. Go ahead, give them a round of applause, right? You never know what they're going to say sometimes, right? Okay. Yeah. All right, love that. Okay, so let me show you one other video. This is really important to me, so I want to show this to you. This, again, from my fellow veterans. Unfortunately, veterans, military people, exposed to blast injuries and head injuries sets them up for anxiety, depression, and PTSD. And unfortunately, they commit suicide like 28 people a day in America. Horrible tragedy, completely preventable in a large number of ways. This is one of the most remarkable therapies. If you know someone that has PTSD, please let them find out about this. Let me just share this with all of you. One more time.
spent 23 years in the military. I retired 3 years ago. You'd expect to enjoy your retirement.
Life for myself every day was sitting at the house, anxiety, depression, not a lot of energy, didn't want to get out of the house, didn't want to really do much.
Sitting at home, suffering from depression, PTSD, be by myself.
Because so many of our veterans come back with post-traumatic stress syndrome. That's a big problem. They can't think well. Their memory's gone. Their energy level's gone. They don't sleep well. Their relationships are really on the mend, and they really can't get functional jobs.
So normal treatment prior to being pelleted was going to see the doctor. They want to put you in some sort of counseling, anger management. The problem I have with that is it really sets you back, I believe. It doesn't really get to the root of the problem.
You know the interesting thing, conventional medicine, what they do, they think antidepressants, they think memory pills, which resemble amphetamines, and then sleeping pills to sleep at night are the answer. They're really not the answer, because if you look at quality of life, those people are no better off than they were before they were medicated. The reality is at least 50% of those people, especially the ones that have had traumatic brain injury, blast injuries, and those kinds of things in the war, they have hormone imbalances, which begins with the pituitary gland. Their growth hormones are low. Their testosterone levels are low. In women, their estradiol levels are low.
Dr. Donovitz, of course, came over, and we met at the back of the bay at Topgolf, and he was like, just please, please, I promise you, you will feel better. He says, it won't cost you anything. He said, just come to the office and let's get going on this, because I want to see you live a better quality life.
What we do is actually optimize their hormones, get rid of their symptoms naturally using bioidentical hormones. That way you don't have to be over-medicated, and guess what? Their quality of life returns. So they have a great quality of life, instead of being over-medicated where they can't work and they can't function in their relationships with their wives and their children.
A friend told me about Biote. He sent me a link to the website. Thought I'd give it a shot.
I noticed the difference fairly quickly. Family members have come to me and say, wow, we've known you our whole life, and you're doing a lot better.
After the second week, I started leaving the house again. It made me feel wonderful.
I'm smiling more, and I'm enjoying life now.
Get a better quality of sleep at night. Before the therapy, I was sleeping probably 3 hours a night, and now I'm getting a good 6 hours. Pain levels, they're way down. I'm up to running 4 miles a day now. As before, some days I wouldn't even get out of bed.
Bella and I get out pretty much on a daily basis. At the dog park, whatever activity that might be going on, I feel like going now. Before, I didn't feel like going.
With Biote, it's given my retirement back.
And the depression's going away, the anxiety's going away, and the energy levels way up, way up.
Biote changed my way of life.
This treatment has been much better than any treatment I've ever been through over the last 5 years. If you are suffering from PTSD, the medications, the rehashing everything, the counselors, the anger management, there are other options.
It's a simple blood test. What do you have to lose?
I would recommend it for any of my brothers out there, sisters. Please, give it a try.
It's amazing how something so small that's implanted can make a big difference in your life.
Definitely like to thank Dr. D and Mandy for approaching me that day. It has made a great change in my life, and I just want to tell them thank you. Thank you.
Thank you, Biote.
Can't tell you the number of people that have relief from that. I just feel prodded right now to share with you a particular patient in my office. This guy came to see me, and he's a fireman, so he's in his early 30s, and he had been doing testosterone shots from another doctor, and his insurance plan changed, and so it came off and it wasn't being covered, and so he came off his testosterone. And he felt so horrible that he tried to commit suicide 3 times. He had to be admitted to an inpatient psych facility. His testosterone level got down to 170. Okay, it's horrible. And he came in and got his pellets, shows back up in the follow-up visit at 4 weeks. He walks in the door, and I see him. He's got a big smile on his face, and he comes over and he gives me this big fireman hug. I'm like, oh my gosh. I'm like, are you okay? And he's like, I feel so much better. He had no idea. So we've recorded his video. His wife came up to me after he came to one of our seminars and shared his story. His wife comes up on the side. She goes, "Thank you for giving me back the man I married." And now he can, do things. He's productive, and he's a super great fan of it, as you might imagine. So I got countless numbers of these stories, and you guys are going to have some too. Just start recording them and logging them. It's going to impact things in a very big way. One final slide, core nutraceuticals. Again, these are things that make your pellets last longer and work better, restoring that which has been lost. And let me just pause here for just a second and ask if there's anybody in the room that has questions. Now, I don't want you to come up with your personal private medical information because we respect the privacy for that. But if you have a question in general that those people listen to the recording or somebody you think in the room might also want to know just about pellet therapy in general, now would be a good time to ask that, and I'll do what I can to answer it. If not, we'll shut off the recording and then we'll answer other things. I do want to let you know, though, that people ask about, this all sounds really good, what does this kind of thing typically cost? And it's very competitively cost, but I'll tell you that the numbers match out to be. It maps out to be about $4 a day, $4 to $5 a day. And what do we say those energy drinks we're selling for again? About $4 a day. And it's so interesting. So many of my patients have remarked to me, he says, you know what? I was already spending the money, but it was just going out a different avenue. And that lasted for a few hours, and none of that stuff helps me with my brains and my bones and my hearts and all that. So that's what a lot of patients realize, is they're already spending the money, and this is something that can restore that quality of life they've been looking for, not to mention their overall health. So any questions for anyone? Yes, ma'am.
Is it covered under Medicare on your supplementation?
Okay, so she's asking, is an insurance coverage provided some of this? We have found that insurance companies, by and large, don't think this kind of therapy is medically necessary. They think you're just getting older, and that's just part of aging. So we have not found that, nor do we seek that out. But you can use things like FlexSpend and HSA and MSA funds for both the lab tests, the nutritionals, as well as the therapy. So I hope that helps you. Any other question? Yes, ma'am.
We found that labs were covered once a year, but not the actual pellet.
So this other patient remarked that her laboratory was partially covered or covered by her insurance as well. So there you go. And then, yes, ma'am.
So if you already had your labs done, can you get, could I get a copy of those?
You're always welcome to bring that, just as long as they have in it the values we need. A lot of times people may not have all the values. That's usually what we found. Okay, any other questions? Think about the pellets. All right, you don't have to have questions, but you can. Okay. I've been doing this therapy personally I've had 15 insertions. I will tell you that this has been one of the most remarkable things I've ever done and experienced personally as a patient. It's given me a better clarity of mind. I get results in the gym, whereas before I'm not much of a gym goer. It's made me a better husband. It's made me a better father. It's made me a better doctor, because now I personally have felt much better. And I can't tell you the number of countless stories that I have. I mean, my phone is blown up with pictures and videos and all kinds of stuff people have sent me. So I've never in the ER been able to have the kind of results that I get with pellets, and people's gratitude is just sky high. And so all you are nodding your head yes, you're like, you know exactly what I'm talking about, yeah. So we invite you to step over into the land of milk and honey with the rest of us. If not, that's fine too, and we just want to wish you all the best. So with that, let's go ahead and end the recording, and then I think we'll have